Everything that we do rides upon a platform of IT, and so you have to have that. And sadly, our industry today is really fragmented. And what we seek to do is to bring those pieces together. And so when I say we, I'm actually even speaking larger than just CAC and speaking to Humana. And so Humana is seeking to integrate all of the IT components necessary for care. It's connecting hospitals, connecting labs, ancillary services, all of that back and tied into one electronic health record that's then shared with the primary care or shared amongst each. And what that does is it begins to reduce unnecessary treatments, unnecessary costs. It begins to pull that out of the system, and also harm to the patient. If a patient has already had labs done, right, but if you're disconnected when you show up at the hospital doesn't know that those are done. It could have just been done 2 hours prior. So guess what they're going to do? They're going to run more labs, right? That's an extra poke to the patient. So when I say harm, that's what I mean. Same thing happens in reverse, right? The things that are done in the hospital, if it's not connected and if it doesn't ride on that IT chassis or platform, we're not going to know necessarily, or have to rely on paper. So CAC rides on a platform of IT primarily, where we're connected so that when we coordinate care, we have digital x-rays, our electronic health record. And so we're importing information from labs and hospitals and et cetera into the health record so that the primary care, the specialty care, any ancillary care is very coordinated. And so there's one central gold copy, if you will, as to the patient's medical record and chart.